Hello, Dr. Jesse Rossow with Kennedy Vision Health Center, and in this video I'm going to be talking about cataracts. And so basically I'm just going to start with an anatomy lesson and just show you exactly where the cataracts occur and how that process happens and what surgery entails and just how we take care of the cataracts. So basically cataracts are something that develop with age. When you're very young, well, let's start off with this first. So we have our eye model here, you can see. So the front surface of the eye is called the cornea. That's the clear covering of the front surface, and I'm going to take that off. So behind that we have the iris, which is the colored part of the eye. So you can see that when you look at someone's eyes, of course. And in the center of that there's the pupil, which is just this opening right here. And when you look at someone's eye, it looks black because it's dark inside the eye, but on here you can see there's just a clear opening. So that's the pupil that lets light inside your eye. Behind that, actually, there is this clear lens. And this lens is responsible for focusing light inside the eye. And this lens is very flexible and changes shape to help you focus up close. So when you're younger, it changes shape and it helps you to see up close and focus on things near. Basically, as you age, the lens gets less and less flexible, and it starts to age as well as you are aging. And usually beyond 40, most people need reading glasses or bifocals because this lens can no longer change shape to focus up close. Well, in addition to not doing its job very well with time, it starts to get hazy and yellowish, and that's what we call cataracts. So basically it will develop this kind of haziness to it. And so as it's letting light into the eye, when you're younger, it's nice and clear, you can see right through it, no issues there. When it starts to get hazy, you can see that it's hard to see through that, and it starts causing issues like glare, halos around headlights, just blurriness in general. And it starts to cause problems. And at a certain point, we will recommend cataract surgery because we need to fix that so you can see. So what they will actually do, and I'm just going to put this back on. So what the surgeon will actually do is make a little incision in the cornea here and go inside the eye and take out this hazy lens and get rid of it. And they're going to replace that with an implant of a clear plastic lens to put in its place, and they will put that back in there, and they actually put your glasses prescription into this lens so that you can see really well afterwards. Almost like a LASIK procedure, a little bit different. LASIK is the front surface here, whereas the cataract is the lens, but they're fixing that lens to make it clear again so you can see through it. And that's the process of the surgery. We monitor you through that surgery process and make sure things are healing properly afterwards. And after that's taken care of, it typically never needs to be done again. There is sometimes a haziness that can develop on the back surface of the implant that can be cleaned off very quickly and efficiently with a laser, and that's only necessary in a small percentage of cases. But that's typically the only the ever other problem that happens with that implant. And generally, you can see really well again after the cataracts are taken care of. And it's a pretty simple procedure nowadays, and that's about it as far as the cataracts go. So if you have any more questions, any specific questions, or anything that I didn't explain very well or you were having a hard time understanding, you can certainly contact me or contact us at Kennedy Vision, and we'd be happy to answer those questions for you. But otherwise, if you have like I said, any comments or questions, let us know. But otherwise, it's been fun chatting with you again, and I hope you have a great day. Thanks.